In the U.S., many people are starting to worry they'll contract the virus. So here to talk about ways to cope with that stress is Dr. Jon Stevens with the Menninger Clinic. Good morning to you.
Good morning to you.
Yeah, so of course there's so much fear and concern out there over this outbreak, but how do you manage the stress of the coronavirus?
Well, I think the most important thing is to have a plan and take reasonable precautions. So just like we face risk of harm to ourselves and others every day. Here in Houston, just driving a motor vehicle takes risks. So having a spare tire, AAA, looking at your gas tank is something we might do. For this virus, it looks like having supplies of water, extra food if you're over a certain age, social distancing. As a physician, my patients are asking for 90-day refills on their medicines instead of 30 days. That might be a reasonable precaution. I also say we want to avoid fixating on the news. We want to find a reliable news source like Fox 26, look at health updates from our health officials. But some of my patients have fallen into a hole where they're having the TV on all of the time. They're even falling asleep with bombarded by text alerts, radio in the car, TV while they're sleeping, and that's going to increase stress levels. I think it's important to stick to routine. Basically, having structure helps to bind and decrease anxiety. So going through regular routines, there might have to be some adjustments, can help not only alleviate boredom and loneliness and stress, but that's something that can help also.
So how can we best support like our friends or loved ones who may really be fearful or at higher risk for this?
And it's evolving every day. I think we have to recognize that some people have had traumatic health experiences. So watching images of people on respirators or with masks can be triggering for them. They're experiencing nightmares. They're thinking about things that happened to them in the past. For me in the office, I'm seeing patients with health anxiety or with contamination fears related to obsessive compulsive disorder really having a hard time, especially when there's shortages of sanitizing wipes, sanitizers, and even basically things that we want to do, or even testing kits for COVID-19. So they're worried. They're going to the urgent care. They're going to the emergency room, maybe not being able to get tested. They're having a hard time.
Yeah. And so just yesterday, my 8-year-old asked me about the coronavirus. And so what do parents tell their children about this?
Well, I have 3 children too, and the answer can differ according to the age. For my 2-year-old, this does not enter her world. For my 5-year-old, he wants to know if there's baseball practice tonight. And my 7-year-old, he's the scientist. He wants to know, where did this come from? When's the vaccine? Is he going to have to go to the doctor for a shot? I see also teenagers and young adults in the office, and actually their responses are very similar, a mixture of my 3 children. Some it doesn't enter their world. Some are wondering what their spring break's going to look like. Can they travel? And some of them are asking me scientific questions that right now, the information is still hazy, and we don't know everything about this virus.
All right. Well, thank you so much for the update.